Acute and chronic inflammation. The understanding of inflammation, a cornerstone of pathophysiological processes, is critical in discerning disease progression. Acute inflammation manifests swiftly following tissue injury, characterized by redness, swelling, heat, and pain. These responses facilitate the containment of harmful stimuli and promote healing. Acute inflammation is generally protective, lasting for a brief period until the threat subsides. In contrast, chronic inflammation emerges when the inflammatory response fails to resolve, persisting over extended periods. This prolonged state often results in tissue damage, contributing significantly to various diseases, such as arthritis and cardiovascular disorders. The persistence of chronic inflammation marks a maladaptive response, where the body's attempt to protect itself inadvertently causes harm. Healing and tissue repair. Healing and tissue repair are integral processes that follow inflammation. Initially, during healing, the body removes dead cells and replaces them with viable ones. This phase involves two main processes, regeneration and fibrosis. Regeneration restores normal tissue architecture and function through cellular proliferation, predominantly seen in tissues with high regenerative capacity like the liver. Conversely, fibrosis occurs when regeneration is incomplete, resulting in scar formation as fibroblasts create connective tissue. Proper regulation of these processes determines the functional outcome of tissue repair. Dysregulation can lead to excessive scarring or insufficient healing, impairing organ function and highlighting the complexity of tissue repair mechanisms in diseases such as cirrhosis. Autoimmunity. Autoimmunity represents a fascinating yet detrimental aspect of disease progression where the immune system mistakenly targets the body's own cells. This misdirected immune response is pivotal in conditions such as lupus and rheumatoid arthritis. Autoimmune disorders arise from complex interactions between genetic predisposition and environmental factors, leading to chronic inflammation and tissue damage. The breakdown in self-tolerance is central to autoimmune disease mechanisms, with autoreactive T and B cells playing critical roles in perpetuating inflammation. Thus, a comprehensive grasp of these progression patterns underpins a nuanced understanding of pathophysiological processes, informing treatment strategies across a spectrum of diseases. The role of the nervous system in diseased neurological pathways. The nervous system plays a pivotal role in maintaining the body's homeostasis and facilitating complex bodily functions. Neurological pathways consist of an intricate network of neurons responsible for transmitting signals between various parts of the body and the brain. These pathways are crucial in relaying sensory information, motor instructions, and reflex actions, all of which contribute to the body's proper functioning. Disruptions in these pathways often lead to significant health issues. The etiological aspect involves various factors, such as trauma, infections, or hereditary conditions, that can lead to malfunctioning pathways. An understanding of these pathways is fundamental in diagnosing and treating neurological diseases. Advanced imaging technologies, such as MRI and PET scans, provide critical insights into how these pathways operate and the nature of any disruptions. This knowledge assists in developing targeted treatments and interventions, underscoring the importance of neurological pathways in medical research and practice. Neurodegenerative disorders. Neurodegenerative disorders represent a category of diseases characterized by the gradual degeneration of the structure and function of the nervous system. These disorders include Alzheimer's disease, Parkinson's disease, Huntington's disease, and amyotrophic lateral sclerosis, ALS, each with unique pathophysiological mechanisms yet sharing common traits. They typically have a profound impact on cognitive and motor functions, leading to debilitating effects on patients' quality of life. Among the primary concerns is the progressive loss of neurons, which is irreversible and leads to the declining ability of the nervous system to perform vital functions. The underlying causes are complex, often involving genetic, environmental, and age-related factors. Despite advances in understanding these diseases, effective therapeutic strategies remain limited. Research is ongoing to explore novel treatments, such as gene therapy, targeted drug development, and neuroprotective strategies. One central focus is on the early detection of neurodegenerative disorders, which can potentially delay progression and improve outcomes. Efforts in this field involve a holistic approach, integrating genetic studies, biomarker development, and the exploration of lifestyle influences. The comprehensive study of neurodegenerative disorders holds promise for alleviating the burden of these diseases and improving patient care through innovation and interdisciplinary collaboration. Pathophysiology of cardiovascular disorders. Hypertension mechanisms. The pathophysiological mechanisms underlying hypertension are complex and multifactorial. Hypertension often results from the interplay between genetic predisposition and environmental factors. A key aspect involves the renin-angiotensin-aldosterone system, ROS, which regulates blood pressure and fluid balance. Overactivation of ROS leads to vasoconstriction and increased blood volume, elevating blood pressure. Additionally, sympathetic nervous system hyperactivity enhances heart rate and vascular resistance. Endothelial dysfunction further contributes by impairing vasodilation through nitric oxide pathways, leading to increased vascular tone. Ultimately, these processes result in sustained elevated blood pressure, causing gradual damage to cardiovascular structures. Heart failure pathways. Heart failure arises as a consequence of myocardial injury or stress, culminating in the heart's inability to pump blood effectively. Pathophysiological pathways involve hemodynamic and neurohormonal alterations. Initially, the heart compensates for reduced function through mechanisms such as increased heart rate and myocardial hypertrophy. Over time, these compensatory responses prove maladaptive, contributing to progressive cardiac remodeling. Neurohormonal systems, including ROS and sympathetic activation, exacerbate fluid retention and vasoconstriction, worsening heart function. Moreover, inflammatory cytokines perpetuate cardiac damage and fibrosis. Eventually, decompensation sets in, characterized by clinical manifestations of heart failure such as dyspnea and edema. Atherosclerosis. Atherosclerosis is characterized by the development of atheromatous plaques within arterial walls, posing a significant risk for cardiovascular events. The process initiates with endothelial injury and dysfunction, often due to factors like hypertension, hyperlipidemia, and smoking. This injury permits lipoproteins, particularly low-density lipoproteins, LDL, to infiltrate the intima. Subsequent oxidative modification of these lipoproteins triggers an inflammatory response, attracting macrophages and forming foam cells. Progression involves smooth muscle cell migration and proliferation, contributing to plaque stability. Nevertheless, plaque rupture or erosion can lead to thrombus formation, often precipitating acute coronary syndromes. Chronic inflammation and continued lipid accumulation maintain the cycle of atherosclerotic progression, underscoring the need for comprehensive risk management in susceptible populations. Respiratory pathophysiology. Asthma pathogenesis. Asthma, a chronic inflammatory disorder of the airways, is characterized by varying episodes of airway obstruction and bronchial hyperreactivity. Central to its pathogenesis is the interaction between genetic predisposition and environmental factors such as allergens, pollutants, and viral infections. The inflammatory response in asthma involves numerous cellular components, including eosinophils, mast cells, T lymphocytes, and macrophages, which release mediators like cytokines and leukotrienes. These mediators drive the characteristic features of asthma: smooth muscle contraction, increased vascular permeability, and mucus overproduction, leading to symptoms such as wheezing, coughing, and shortness of breath. Advances in understanding asthma pathogenesis have highlighted the role of Th2 cells and their cytokines, including interleukin-4, interleukin-5, and interleukin-13, which are pivotal in orchestrating the inflammatory response. Chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, COPD, is a progressive disease characterized by airflow limitation that is not completely reversible. The primary risk factor for COPD is tobacco smoke, although other environmental pollutants also contribute. The pathophysiology of COPD involves chronic inflammation of the airways, parenchyma destruction, and disruption of normal repair mechanisms. Key pathological changes include increased numbers of macrophages and neutrophils in the airways, goblet cell hyperplasia, and squamous metaplasia. The destruction of alveolar structures results in emphysema, reducing the surface area for gas exchange. Inflammatory processes in COPD differ from those in asthma, with a dominance of Th1-type cytokine response rather than Th2. This results in chronic bronchitis and emphysema, culminating in symptoms such as chronic cough, dyspnea, and sputum production. Pneumonia and lung infections. Pneumonia and lung infections represent significant causes of morbidity and mortality worldwide, involving the inflammation of the lung parenchyma and alveoli. Pneumonia pathophysiology depends on the type of pathogen involved, bacterial, viral, or fungal, each invoking a unique immune response. Bacterial pneumonia typically leads to exudative inflammation, with alveolar macrophages playing a crucial defensive role. Viral infections often cause interstitial pneumonia, marked by lymphocytic infiltration and injury to the alveolar septae. Inflammatory cytokines and chemokines facilitate immune cell recruitment to the infection site, endeavoring to eradicate pathogens yet sometimes causing tissue damage. Understanding these processes is imperative for developing effective therapeutic strategies and improving patient outcomes. Endocrine system dysfunctions. Diabetes mellitus. Diabetes mellitus is a chronic condition characterized by either insufficient insulin production or an inability of the body to effectively utilize the insulin it produces. This dysfunction in the regulation of blood glucose levels leads to hyperglycemia, which, over time, can result in severe damage to essential body systems, particularly the nervous and vascular systems. The classification of diabetes includes type 1, where the body's immune system attacks insulin-producing cells, and type 2, which involves resistance to insulin action or reduced production. Gestational diabetes, occurring during pregnancy, also falls under this category. The management of diabetes focuses on maintaining blood glucose levels within a normal range through a combination of diet, physical activity, medication, and regular monitoring. Thyroid disorders. Thyroid disorders stem from overproduction or underproduction of thyroid hormones, which regulate metabolism. Hyperthyroidism, characterized by excessive hormone production, accelerates metabolism, causing symptoms such as weight loss, increased heart rate, and anxiety. In contrast, hypothyroidism results from thyroid hormone deficiency, leading to a slowed metabolism, weight gain, fatigue, and depression. An autoimmune process often triggers these conditions. Graves' disease is a common cause of hyperthyroidism, while Hashimoto's thyroiditis frequently leads to hypothyroidism. Treatment options vary from medication to balance hormone levels, to surgical interventions in certain cases where chronic imbalances or nodules pose threats to health. Adrenal imbalances. Adrenal gland dysfunction affects the production of hormones like cortisol, aldosterone, and adrenaline, crucial for stress response, metabolism, immune function, and blood pressure regulation. Conditions such as Cushing's syndrome, characterized by excessive cortisol, led to symptoms including weight gain, hypertension, and osteoporosis. Conversely, Addison's disease, marked by insufficient hormone production, results in fatigue, muscle weakness, and hypotension. These disorders often require hormone replacement therapy or surgical treatments to correct hormone levels. Proper diagnosis is essential as symptoms can mimic other conditions, complicating treatment approaches and necessitating a comprehensive endocrine evaluation. Understanding these dysfunctions is crucial for developing effective interventions and improving patient outcomes. Gastrointestinal pathologies. Inflammatory bowel diseases. Inflammatory bowel diseases, IBD, which primarily include Crohn's disease and ulcerative colitis, represent chronic inflammatory conditions of the gastrointestinal tract. These disorders are characterized by relapsing episodes of inflammation, leading to a range of symptoms such as abdominal pain, diarrhea, and weight loss. The etiology of IBD is multifactorial, involving genetic predispositions, environmental factors, and an inappropriate immune response to intestinal flora. Advanced research highlights the role of cytokines in pathogenesis, where an imbalance between pro-inflammatory and anti-inflammatory cytokines exacerbates intestinal damage. Management strategies focus on anti-inflammatory medications, biologics, and lifestyle modifications to achieve and maintain remission. Liver damage and regeneration. The liver's remarkable ability to regenerate is a unique physiological phenomenon. Hepatic damage can result from various causes, including viral infections like hepatitis, excessive alcohol consumption, and metabolic disorders such as non-alcoholic fatty liver disease. When liver cells are damaged, a complex regenerative process initiates, involving hepatocytes as well as non-parenchymal cells like hepatic stellate cells. Regeneration is tightly regulated by growth factors and cytokines, ensuring restoration of liver tissue and function. Despite the liver's regenerative capacity, chronic insults can lead to fibrosis and cirrhosis, necessitating early intervention to prevent irreversible damage. Therapeutic approaches often emphasize lifestyle changes, pharmacologic interventions, and in severe cases, liver transplantation. Pancreatic disorders. Pancreatic disorders encompass a range of conditions, including pancreatitis, pancreatic cancer, and diabetes mellitus, each presenting distinct pathophysiological processes. Acute pancreatitis is typically a sudden inflammation of the pancreas, often attributed to gallstones or excessive alcohol use, whereas chronic pancreatitis results from prolonged inflammation leading to permanent structural damage. Pancreatic cancer, a highly lethal malignancy, proves challenging to treat due to late diagnosis and aggressive progression. Diabetes mellitus, characterized by insulin dysfunction, poses significant health risks and requires comprehensive management strategies. Effective treatment of pancreatic disorders necessitates a multidisciplinary approach, addressing underlying causes, symptom management, and potential surgical interventions to improve patient outcomes and quality of life. Renal system pathophysiology. Kidney injury. Kidney injury often manifests in two primary forms, acute and chronic. Acute kidney injury, AKI, is characterized by a sudden decline in kidney function, typically caused by factors such as inadequate blood flow, direct damage to the kidneys, or obstruction of urine flow. The consequences of AKI include the accumulation of waste products in the bloodstream, leading to potential disturbances in other organ systems. Identifying the underlying etiology is paramount for effective treatment. In contrast, chronic injury stems from prolonged exposure to risk factors, including hypertension and diabetes, which progressively impairs renal function over months or years. Early intervention in managing these conditions can mitigate further damage. Chronic kidney disease. Chronic kidney disease, CKD, represents a sustained loss of renal function, often going undetected until significant damage has occurred. The pathophysiological mechanisms involve hyperfiltration, glomerular sclerosis, and tubular atrophy. The progression of CKD is often insidious, marked by stages ranging from mild loss of kidney function to its complete failure. Each stage requires tailored management strategies, including lifestyle modifications, dietary restrictions, and pharmacologic interventions, to slow disease progression and alleviate symptoms. Regular monitoring is essential in assessing the disease trajectory and adjusting therapeutic approaches accordingly. Proper fluid and electrolyte management are crucial components in the treatment of renal pathophysiology. Disruptions in kidney function adversely affect the body's ability to maintain homeostasis of fluids and electrolytes. Imbalances such as hyperkalemia, hyponatremia, and metabolic acidosis are frequent concerns, especially in advanced stages of kidney disease. Managing these imbalances involves a comprehensive approach, combining dietary management with pharmacotherapy to maintain electrolytes within safe limits. Implementation of dialysis, where appropriate, further aids in cleansing blood plasma, mimicking normal renal function. Enhancing the quality of life for individuals afflicted with renal pathophysiological conditions. Reproductive system pathologies. Infertility causes. Infertility remains a significant concern impacting numerous individuals globally. Several factors contribute to infertility, necessitating a comprehensive understanding of its origins. Primarily, infertility can stem from either male or female reproductive challenges, though often it involves both. In males, the primary causes include low sperm production, abnormal sperm function, and obstructions that prevent sperm delivery. These conditions can arise due to various health issues such as diabetes, cystic fibrosis, trauma, and infections. Additionally, lifestyle factors including smoking, alcohol consumption, and exposure to environmental toxins can adversely affect male fertility. In females, infertility often pertains to ovulatory disorders, which impede the release of eggs from the ovaries. Polycystic ovarian syndrome, PCOS, is a prevalent condition associated with ovulatory dysfunction, leading to irregular menstrual cycles and impaired fertility. Uterine or cervical abnormalities, such as polyps or fibroids, can also obstruct fertility by interfering with egg implantation or fetal development. Endometriosis, where tissue resembling the uterine lining grows outside the uterus, can cause scarring and inflammation, leading to infertility. Furthermore, age plays a crucial role as the number and quality of eggs decrease significantly as women age. Hormonal dysregulation. Hormonal dysregulation is a critical underlying factor contributing to many reproductive system pathologies, including infertility. The endocrine system orchestrates the delicate balance of hormones necessary for reproductive health. Disruptions in this balance can lead to several issues. For instance, an imbalance in hormones such as estrogen and progesterone may result in irregular menstrual cycles, affecting ovulation and fertility. One notable disorder involving hormonal dysregulation is hyperprolactinemia, where elevated levels of prolactin inhibit ovulation. This condition, often caused by benign pituitary tumors, leads to irregular or absent menstrual cycles, thereby impeding conception. Thyroid dysfunction also impacts reproductive health. Hypothyroidism, characterized by insufficient thyroid hormone production, can cause menstrual irregularities and infertility due to its influence on hormonal metabolism. Addressing these hormonal imbalances often requires a multidisciplinary approach, involving endocrinologists, gynecologists, and fertility specialists. Treatments may include lifestyle modifications, medication to restore hormonal balance, or surgical interventions if structural issues are present. Understanding the intricacies of hormonal regulation remains paramount for developing effective therapeutic strategies to mitigate the impacts of reproductive pathologies. Musculoskeletal system disorders. Osteoporosis mechanisms. Osteoporosis is characterized by a reduction in bone mass and the deterioration of bone tissue architecture, increasing fracture risk. Central to its mechanism is an imbalance between bone resorption and formation. Osteoclasts, which break down bone tissue, become more active compared to osteoblasts, which form new bone. This imbalance is often driven by hormonal changes, particularly the decrease in estrogen levels in postmenopausal women. Estrogen plays a crucial role in maintaining bone density by inhibiting osteoclast activity. When its levels drop, there is an upsurge in the activation and lifespan of osteoclasts, leading to increased bone resorption. Moreover, genetic factors significantly influence individual susceptibility to osteoporosis. Variations in genes related to bone metabolism can affect bone density and quality. Lifestyle factors, such as insufficient calcium and vitamin D intake, sedentary behavior, and smoking, further exacerbate bone density loss. These factors collectively contribute to the disruption of the remodeling process, skewing it in favor of bone degradation. Significant bone loss without corresponding regeneration can compromise skeletal integrity, heightening fracture susceptibility. Hence, understanding these mechanisms is vital in developing therapeutic strategies to prevent and manage osteoporosis. Muscle degeneration. Muscle degeneration, often highlighted in aging and various neuromuscular diseases, primarily concerns the loss of muscle mass and function, known as sarcopenia. This condition arises from complex interactions between genetic predispositions, hormonal changes, and inflammatory pathways. With aging, there is a decline in anabolic hormones such as growth hormone and testosterone, which are essential for muscle cell growth and repair. This decline contributes to muscle protein breakdown outweighing synthesis, resulting in muscle fiber atrophy. Inflammation also plays a critical role. Chronic low-level inflammation, common in older adults, can interfere with muscle repair mechanisms, further exacerbating muscle loss. In addition, neural drive to muscles diminishes with age, affecting coordination and strength. Mitochondrial dysfunction is another contributing factor, impairing energy production necessary for muscle maintenance and function. Physical inactivity compounds these issues, accelerating muscle degeneration. Regular exercise, particularly resistance training, can mitigate muscle loss by promoting muscle protein synthesis and improving mitochondrial health. Interventions focusing on nutritional support and hormonal therapy can also aid in preserving muscle mass and function. By addressing these underlying processes, we can better design strategies to counteract muscle degeneration's impact on mobility and quality of life. Integumentary system diseases. Skin disorders. The integumentary system, primarily composed of skin, is vital for protecting the body against external harm. Skin disorders encompass a diverse range of conditions affecting the skin's structural and functional integrity, each with unique pathophysiological mechanisms. Common skin disorders include psoriasis, eczema, and acne. Psoriasis is characterized by an accelerated proliferation of skin cells leading to thick, scaly patches. This is primarily due to immunological dysregulation where the immune system mistakenly targets healthy skin cells. Eczema, or atopic dermatitis, involves inflammation accompanied by itching and redness, often triggered by environmental allergens or irritants, and linked to genetic mutations affecting the skin barrier. Acne, a prevalent issue among adolescents, involves the sebaceous, oil, glands, hair follicles, and bacteria, resulting in pimples and potential scarring. Understanding these disorders necessitates a deep exploration of genetic, environmental, and immunological factors. Wound healing processes. Wound healing is a complex biological process critical for restoring skin integrity after damage. This process is typically divided into 4 overlapping phases: hemostasis, inflammation, proliferation, and remodeling. Hemostasis occurs immediately after injury to prevent excessive blood loss, involving platelet aggregation and clot formation. The inflammatory phase follows, characterized by neutrophil and macrophage infiltration, which helps eliminate debris and pathogens. During the proliferation phase, fibroblasts and keratinocytes facilitate tissue formation, angiogenesis, and reepithelialization, contributing to wound closure. Finally, the remodeling phase involves the maturation of new tissue and the reorganization of collagen fibers to enhance tensile strength. Several factors impact wound healing, including age, nutrition, and comorbidities such as diabetes. Disruptions in this process can lead to chronic wounds, which remain a significant clinical challenge. Research into advanced regenerative therapies, such as stem cell treatments and biomaterials, is ongoing to enhance wound healing outcomes and reduce the burden of chronic wounds. Understanding the intricacies of wound healing is crucial for developing effective treatments and improving patient care in clinical settings. Immune system and pathophysiology. The immune system plays a pivotal role in the body's defense mechanism, functioning to identify and neutralize foreign entities such as pathogens, toxins, and abnormal cells. Understanding the pathophysiological processes involved in the immune response is crucial for appreciating how the body maintains homeostasis and combats diseases. Immune response mechanics. The immune response involves a highly coordinated sequence of events, starting with the recognition of antigens. This recognition is primarily mediated by specialized cells, including macrophages and dendritic cells, which present antigens to lymphocytes. Upon activation, T cells and B cells proliferate, differentiating into cells that directly attack pathogens or produce antibodies. The innate immune response provides an immediate but non-specific defense, while the adaptive response is slower yet highly specific and capable of memory. This complex interplay ensures a robust defense against a wide array of potential threats. Hypersensitivity reactions. Pathophysiological processes also involve hypersensitivity reactions, which are exaggerated immune responses that result in tissue damage. These reactions are categorized into 4 types. Type 1 hypersensitivity involves IgE-mediated responses, commonly seen in allergies and asthma. Type 2 is cytotoxic, where antibodies target cells, leading to conditions such as hemolytic anemia. Type 3 involves immune complex-mediated reactions, contributing to diseases like lupus. Type 4, or delayed type hypersensitivity, involves T-cell-mediated responses, significant in conditions like contact dermatitis and some autoimmune diseases. Understanding these mechanisms is critical for developing treatments for allergic and autoimmune disorders. Immunodeficiency. Immunodeficiency represents another facet of pathophysiology, characterized by an inadequate immune response. This can be congenital, such as in severe combined immunodeficiency, SCID, or acquired, as seen in the case of human immunodeficiency virus, HIV, infection. Immunodeficiency disorders lead to increased susceptibility to infections and a heightened risk of malignancies due to impaired surveillance. Exploring the underlying causes and mechanisms of immunodeficiency helps in developing effective therapeutic strategies and interventions, thus improving patient outcomes. This understanding is essential for advancing medical research and enhancing the quality of life for affected individuals. The study of immune system pathophysiology provides invaluable insights into disease prevention, diagnosis, and treatment strategies, making it a vital area of research in medical science.